As of 2023, around 40 states have passed laws limiting the use of leg shackles, handcuffs, and belly chains while prisoners give birth. However, there are still reports of law enforcement agencies ignoring these policies and moving forward with restraints.
I started working as a physician providing obstetrical and gynecologic care to women in the San Francisco jail. And after just a few months of being a physician there, I recognized and experienced a lot of tensions and contradictions of providing care in a space of punishment. So once I began to really notice that, which I think if anyone in a caregiving profession works inside of a jail or prison, it's kind of hard to ignore that tension. It's something that I really wanted to explore more deeply.
Dr. Carolyn Sufrin explores the ins and outs of being pregnant and incarcerated in her book, Jail Care: Finding the Safety Net for Women Behind Bars.
Incarcerated people are the only people in our country with a constitutional right to health care. That's something that most people aren't aware of, and that might strike some of the listeners as unusual. So if you think about it, you and I, in the so-called free world, we do not have in this country a constitutionally guaranteed right to health care. Neither does someone who was at one point incarcerated. But when they become incarcerated, they lose most of their rights. That's part of the punishment, is being stripped of most of your rights. And yet what you gain is this right to health care that you don't otherwise have outside. And that right to health care for incarcerated people comes from a 1976 Supreme Court case, Estelle versus Gamble, in which the Supreme Court said that not to provide health care or not to tend to the serious medical needs of prisoners is basically cruel and unusual punishment, therefore violates the Eighth Amendment.
Though inmates are guaranteed health care, Sufrin says there is no real standard for how attentive that health care must be across the country. She says in her years working with inmates, she saw a whole host of women as they struggled with their status as pregnant and incarcerated.
Every woman has a different response to it, but I would say what I most commonly observed among women like Evelyn and like Kima, another woman I came to know quite well, and others who were pregnant while in jail, a lot of them were really scared being pregnant behind bars, not knowing what kind of medical care they were going to receive. And in the book, I described the care that exists at the San Francisco jail. And of course, I should acknowledge that I provided some of that care. But the care that's provided at the San Francisco jail is relatively better than at many jails across this country, where women, pregnant women in particular, do not receive adequate prenatal care. And that leads some women to deliver their babies in their jail cells when they're not taken to the hospital in time. And so a lot of women in jail, a lot of pregnant women in jail are really scared about their own health and safety of being pregnant.
Sufrin says she was present once for a disturbing delivery behind bars that never left her mind since. The guards in the facility actually shackled her patient with handcuffs before the delivery.
I never even conceived that this is something that could be possible. And I was so taken aback. I didn't even know what to do. I didn't know if I had the authority to ask the prison guard to remove the shackles. I just didn't know what I would do. But I knew that it felt unsafe, and I knew that it was incredibly dehumanizing and demoralizing for the woman giving birth. And I also knew that I was unsure what I would do if there was an emergency. I actually have a colleague who told me about a time when they needed to do an emergency C-section, which required transporting a patient from her labor and delivery room into the operating room, but she was shackled to the bed, so she couldn't be transported to the operating room, and the guard was on his lunch break. And so there was no one to unlock the restraints, and this led to an unnecessary delay in emergency medical care.
Sufrin says since those incidents, much progress has been made to protect mothers from such care. Still, she says there is more that needs to be done.
Since then, there are now 22 states across this country that ban the shackling of pregnant women in labor. The Federal Bureau of Prisons also has a policy against it, and the District of Columbia also has a law. Now, that's only 22 states. That means in 28 other states, it is perfectly legal to shackle a pregnant woman in labor. It's just because our institutions of incarceration are so mired in this culture of power and hierarchy and seeing prisoners as dangerous and worthy of punishment that you have to pass a law to prohibit something that for most medical professionals and probably most people in society seems like common sense. How could a woman in labor be a risk to public safety? Could she really run off in between painful contractions? And also just the basic threats to human dignity that it poses.
Sufrin says she wants people to come away from this book understanding what types of obstacles pregnant inmates face, and then to reevaluate how those people should be treated.
These are not just women who are somewhere else who are not connected to you in any way, because these are people who are part of our society, and most of them, especially most of the women who are incarcerated, have not committed violent crimes. Most women who are in our criminal justice system are there for nonviolent offenses that are often related to their conditions of disadvantage, of poverty, of drug addiction, of racial injustice. And so these are people who are part of our society, and it's all of our responsibility to think about how we can better serve these women, better help ensure that they're not incarcerated, and make sure that they're getting better and more appropriate medical care while they're incarcerated, but also while they're in the community. So again, this is really about all of us. This is not about people who are locked up and far away from all of us. This is our society.
To find out more about this topic and our guest, Carolyn Sufrin, visit viewpointsradio.org. For more behind the scenes and to support our show, follow us on Instagram, X, and Facebook. This segment originally aired in February 2019 and was written and produced by Evan Rook. Our executive producer is Amira Zuberi. I'm Gary Price.